Now to the battle with the bulge, and a new study is warning those who stop taking drugs like Ozempic rapidly regain weight and are often back to their old size within 2 years. And Dr. Catherine Bacus specialises in weight loss management. She joins us now from Melbourne. We've heard these medications called wonder drugs so many times, but surely not so wonderful if people have to keep them on forever to keep their weight down.
Yeah, well, it's really interesting because these medications have been life-changing for many of our patients. We know they're highly effective for reducing weight. They also help to improve risk of cardiovascular events, renal disease, fatty liver, type 2 diabetes. Numerous conditions are improved by these medications. But yes, obesity is a complex, lifelong condition that does require long-term management. And when patients lose weight, the body thinks that there's a famine going on and it tries to defend us against weight loss. So hunger hormones go up after weight loss. Fullness hormones like GLP-1 go down, which makes us feel more hungry after a meal. And our body tries to conserve energy and help us to drop our metabolic rate. And all of these things are in the direction of weight regain. So yes, it does require lifelong management. This is not a condition of having enough willpower. And that's the really important message I want to get across. And these medications do help to override those hunger hormones to help keep that appetite at bay and keep the weight down. But when they're removed, yes, your body will return to its underlying set point of weight. And that's just nature.
Are these drugs safe to be on for a lifetime?
Well, they've been around for 25 years in their earliest form, and so these have been used across millions and millions of people. And there are some common side effects such as gastrointestinal side effects like nausea, constipation, reflux, diarrhea. In some patients they have pancreatitis or gallstone conditions, but we haven't seen any worrying safety signals across these millions of patients who have been on them. They've been bandied around the risk of thyroid cancer, but that was shown in rats and not in human beings. And there's a rare condition that affects the eye in susceptible individuals, but it's extremely rare.
Yeah, well, none of that sounds good to me. These pharmaceutical companies must be ecstatic. Does this mean people have to stay on these drugs for life? They basically have a customer for life.
You look at conditions like high blood pressure, thyroid conditions, diabetes. When an individual starts a blood pressure medication, their blood pressure is controlled. And when you withdraw that treatment, the body returns to its underlying dysfunctional blood pressure. So that's not a surprise. If you start a treatment, it works. When you withdraw the treatment, then your body is left with the underlying dysfunction. And that's what happens in obesity as well. But yes, we do look at it as a lifelong condition that does require lifelong treatment. And I guess that's where we're, heading is the cost is the real barrier for patients. So we're appealing to the drug companies to look at how they're pricing these medications in the marketplace. We're lobbying the government to look at whether some of these medications can be listed on the PBS. There has been a recent recommendation that Wegovy is added to the PBS for cardiovascular disease in patients who are also living within a larger body. But we would like to see some of these medications at least partially funded for the treatment of obesity.
Well, Dr. Catherine Bacus, thank you so much for joining us and taking us through it.
No worries. It's great to be with you today.
And coming up, the push